Hey, thanks for joining me on For the Love of Medicine. Today I'm going to talk about something that's near and dear to me, and this is the burn injury. Talking about chemical and thermal burns. So this video is mainly for those of you that work in the emergency department that might even see a burn patient come through your doors. My intent is to share what I've learned, and that hopefully both of us can grow together and we can take better care of these patients that come across our path. So please don't forget to subscribe so you don't miss any future content. For those of you that are unfamiliar with the burn injury, it is arguably the most brutal assault on the human body of any of the traumas that you can have out there. The amount of fluid, the amount of nutrition that a burn patient would need, and the amount of care that a burn patient would need far exceeds anything else that they can encounter throughout their whole life. So we want to talk about the burn injury. And why am I talking about burn injury? I'm a respiratory therapist. So just a little bit about me really quick. I'm a respiratory therapist at BAMC. Now I work for the ISR, the Institute of Surgical Research. And at the ISR, we have the only Department of Defense burn center. We have our own operating room, we have our own rehab department, our own respiratory department, and we have a set staff for nursing and surgeons and doctors that take care of these burn patients. I am also a certified ABLS instructor through the ABA, which is the American Burn Association. As a disclaimer, anything in this video is purely for knowledge and understanding what the burn does to the patient. But all the decisions and the care for the patient should be according to your hospital's protocol and according to the ABA. And don't forget to call your local burn center before making any drastic changes to the patient. So let's give a little scenario about what can happen. We had a patient recently that was working on a train on one of those oil tankers. He was cleaning it out, he was inside, and a spark ignited all the fumes that were inside that oil tanker. Now this patient was in there for a long time, and once he was extracted, there are multiple things that need to happen for this patient to increase his chance of surviving. The first thing you want to do is stop the patient from burning. Okay, now I say this because the next one is going to be a little counterintuitive, but you want to stop the burn. You want to make sure the flames are out, make sure that no longer has any chemicals that can cause burns on them. Now, next thing you want to do, and this is most important, you need to keep the patient warm. Now, our skin is very involved in keeping our body temperature. Now, when you lose that protective barrier, when you lose your skin, you are no longer able to regulate your body temperature. And it is dangerous for burn patients to get low body core temperatures. And it takes hours to bring these patients back up to temperature. Our rooms at the ICU are set at 100 degrees. And many patients, we have to have heat lamps on them, on top of the dressings, on top of the warming blankets that we have on these patients, and we still struggle keeping them warm. Cooling the patient off will only injure them further. So stop the burn, keep them warm, cover them with a clean, dry sheet. The next thing we want to talk about is do not bolus fluids. Now when these patients get burned, they will go into burn shock. Their blood pressure will drop, their respiratory rate will increase, they will have low fluid in their vasculature. But where is this fluid going? They're not bleeding, they're not losing fluid just by breathing. What they're doing is they're dumping this fluid into their third space. So these patients are going to swell. If you bolus fluid, especially if you bolus normal saline, all of that saline is going to dump into the third space. So what's most important is you start them on a drip. You start them on a consistent drip of a crystalloid or lactated ringers to be able to get this patient back up to a euvolemic state. Now these patients may require pressures until you can get them to a certified burn unit. And the last thing I want to talk about, I've already mentioned, these patients are going to swell. Now if the burn is severe, the ABA says over 20%. If the burn is severe and it looks like they're going to have a hard time breathing, you need to intubate these patients. Now don't intubate someone that doesn't need it. Talk to your burn center though. Intubate the patients that need it because their airways are going to swell, their airways can close off, And if you wait too long, you won't be able to get a tube in, and now you have an emergency crisis situation. And so regardless of how severe the burn is, if it's a bubbling second-degree sunburn or all the way up to a full-thickness gasoline burn on a patient, you need to consult your local burn center. Consulting with the burn center will help you make the right decision. There's certain criteria that will cause a patient to need to be transferred to a burn center. Now, I hope this video has helped you understand your protocols a little bit for your hospital and for the ABA. And I really hope that this content helps you understand a little more about what the burn does to a patient and how we can best help these patients survive and have the shortest hospital stay as possible. I appreciate you watching this video. My name is Scott Clausen for the Love of Medicine, and I hope that we can learn, share, and grow together as I progress through this journey with you. So please don't forget to subscribe so you don't miss any future content. And I hope that we can continue to share ways to help our patients and to help us be better healthcare practitioners.